Welcome to Horizon Medical Education Podcast, concise, evidence-based audio lessons for clinicians worldwide. For supporting notes, accreditation, certificates, and access to all our courses, visit our platform at www.horizonmedicaleducation.com. And just as a reminder, this podcast is intended for medical professionals and for educational purposes only. It does not replace clinical judgment or local guidelines. Episode 5, Personal Protective Equipment, or PPE.
I'm Fran.
And I'm Minnie.
And please do give us your feedback on this course.
Our tip today is you are the most important person during every interaction with a suspected contagious case. Take your time to correctly don PPE and doff PPE, even in an emergency.
So this is an update on a course that you and I recorded during COVID, during those very busy times. And why are we revisiting it? Well, there has been a surge of infectious diseases recently in the news. So in January, there was Marburg in Ethiopia. More recently, there was hantavirus on a cruised ship sailing around Europe. And now there is sadly an outbreak of Ebola in the DRC and Uganda. Caring for these patients with these contagious illnesses risks transmission to us healthcare workers, and staying safe is paramount. So we are the main priority.
Yeah, absolutely. So we're going to just run through, aren't we, what personal protective equipment is, PPE, different circumstances where you need to wear different types of PPE, just to remind us all. And also just helps you to think about what protection you need before you do any procedure.
Brilliant.
So what is PPE? PPE refers to specialised equipment healthcare workers wear to create a barrier between themselves and potential hazards. And these include infectious agents, so that's bacteria, viruses, fungi, bodily fluids, chemical and disinfectants, and environmental contaminants. PPE helps minimise these occupational risks. Making proper usage is critical for effective infection prevention and control, IPC.
Let's just remind ourselves, because there are 10 elements of standard infection control precautions, and we've done a course on hand hygiene. And if you haven't listened to it, please do, because I think it's so important. And sometimes we just forget to do the really basic, really important things. So the 10 elements are patient placement and assessment of infection risk. And so that is, should you be putting that person in isolation unit, or should you be making them wait in a different waiting room? Number 2, hand hygiene. 3, respiratory and cough hygiene. 4 is personal protective equipment, and that's what we're talking about today. 5 is safe management of the care environment.
6 is safe management of care equipment. 7 is safe management of healthcare linen. 8 is safe management of blood and bodily fluids. 9 is safe disposal of waste, including sharps. And 10 is occupational safety, managing prevention of exposure. And that again includes sharps. So these are things that we're dealing with on a day-to-day basis, but you don't necessarily think about it in terms of infection and protection, do you?
Well, I think sometimes you just do it automatically, don't you? But I think just revisiting the reasons behind it, the rationale behind it, is a really good thing, isn't it? And, so why does it matter for us all in healthcare, Minnie? Using it correctly, it prevents infection transmission, it protects vulnerable patients, it reduces occupational exposure risk. So for us healthcare workers who are listening to this course, or for you or me, this is really important for us as well. It enhances workplace safety, which is so vital, and also it supports regulatory compliance, whoever your regulatory body is, whether that's CDC or WHO.
Yeah, PPE is a foundational part of modern infection control programs, especially during outbreaks or during high-risk procedures. In the Ebola virus outbreak in West Africa in 2014, over 800 healthcare workers died. And this has a knock-on effect on future healthcare, with increase in things like maternal mortality and under 5 mortality as a consequence, which is a really interesting point, isn't it?
Yeah, absolutely. So it's not just the people who are dying from that illness. It's, what are the long-term consequences, particularly of losing healthcare workers. I thought this was a really interesting paper, and I've put a link to the paper, The Lancet, in the transcript if people are interested. So before we undertake any procedure, all healthcare staff should assess the likely exposure to blood and or other body fluids, non-intact skin or mucous membranes, and wear personal protective equipment that protects adequately against the risks associated with the procedure. It must be put on correctly to ensure patient and staff safety.
And another really interesting point, Fran, is that we need to avoid overuse or inappropriate use of PPE as well. And that's sort of a key principle that ensures that it's risk-based, the PPE you're using, and minimizes its environmental impact. There's so many more things we have to think about with everything we do.
Absolutely. And I was saying to you earlier on, wasn't I, that with one of my trainees, actually he put gloves on for an examination that didn't require gloves. And I was like, why are you wearing gloves? And then we talked about it, because one of the things that more and more in the UK, and I think globally we should be talking about, is the environmental impact of medicine, wasted medicines, how we use equipment, unnecessary tests. And so it was really good for me to be able to spot that and say, actually you're overusing there. It's really important not to underuse, but equally it's important not to overuse.
Yeah. So where appropriate, consideration needs to be given to the environmental impact of sustainable or reusable PPE options as well, versus the single-use PPE. I think that's really what you're saying, isn't it? While adhering to the principles.
Yeah.
So we're going to talk about what PPE needs to be.
Absolutely. And PPE needs to be located close to the point of use. So we talked about this when we were doing hand hygiene, didn't we? That, you need your sink near where you need to wash your hands, otherwise it's not going to happen. So if you don't have PPE near to where you're using it, the risk is that some healthcare people may not use it, or, may skimp on it. So
yeah.
If you're in a hospital setting, it should be near to where you're working. If you are providing care in the community or in people's homes, then you need to be able to transport it with you in a clean receptacle. It needs to be stored to prevent contamination in a clean, dry area until it's required, and expiry dates must be adhered to. So we know a lot during COVID, didn't we, that everyone was scrambling trying to get PPE, and that lots of it arrived that was out of date.
Yeah, absolutely. PPE must be single use only unless specified by the manufacturer. So it's important that you know what the manufacturer is telling you. It needs to be changed immediately after each patient and or after completing a procedure or task. Disposal is obviously really important, so it needs to be disposed of into the correct waste stream, for example, domestic waste, offensive or non-infectious, or into clinical waste. And it needs to be discarded if it's damaged or contaminated.
Just a reminder that reusable PPE such as goggles, face shields and visors must be decontaminated after each use according to manufacturer's instruction. How do we use this? Well, it's called donning and doffing, isn't it, Minnie? That donning is putting it on and doffing is taking it off. And all staff should know how to put on and remove PPE and how to dispose of it, and must do this before leaving the contaminated area. And in fact, actually, I was just reading about how Ebola workers have a dry run. Before you actually go into the setting, do a dry run and make sure that you can put this on properly, because it is so important that you can and you are safe.
And a buddy system so that people can tell you, because you can't see all around yourself, can you? So that's really important.
Yes, and you have to sign it off. We'll go talk about that.
Yeah, we are going to say, yeah.
So we've got some really nice infographics on how to don and doff basic PPE, which we're going to talk about, and then PPE for Ebola. And we're going to put some YouTube links on as well for people that like watching something.
Yeah.
The first thing that you need to do is you need to wash your hands before you put on any PPE. Again, please go back to our hand hygiene course to make sure that you're doing that properly.
Absolutely.
Before beginning, you're going to check which items that you need and that they are available and that they are in the correct size. To put them on, the order you're going to do that is an apron and a gown, your face mask, your respiratory protection equipment, your eye protection, and then your gloves.
Okay, so we're going to talk through the pictures. So first of all, with the apron, you pull it over your head and you tie it securely at the back. Your gown needs to fully cover your torso, neck, down to the knees, over the arms to the end of the wrists, and wrap around the back. And you then fasten it at the back.
Your face mask, depending on what level that is, and we're going to talk about that in due course, you need secure ties or elastic bands at the middle of the head and the neck, and it needs to have a flexible band that you fit snugly to your nose bridge, it should fit snug to the face and below the chin. Respirators, be fit checked. So you need to go off and have that fit checked if you're wearing one of those.
Okay, eye protection. So this is goggles or a face shield. You place it over your face and eyes and adjust it to fit.
And then finally, gloves. Pull on, taking care to minimize contamination of the outer surface by holding the gloves at the wrist opening only. So you don't want to be touching the outside of the gloves. Extend to cover wrist over the gown cuffs if you are wearing a gown. So that is you donned.
Okay, now just run through the doffing process, so the removing of the PPE. And this is really important as well. And the correct technique is essential to avoid touching the most contaminated areas of your PPE. So there's no point in wearing it if you're then going to contaminate yourself as you take it off.
And this is where the greatest risk, isn't it, for contamination?
Absolutely. So the order for removing your PPE is gloves, then apron or gown, then eye protection, and then your face mask or respirator.
So with your gloves, you're going to pinch and lift the outside of the glove in the palm area with the opposite gloved hand and peel off whilst turning the glove inside out. And then you're going to hold the removed glove in the glove hand, slide 2 fingers of the ungloved hand under the remaining glove, and again peel the second glove off over the first glove and discard. That, I think I might have made that sound more complicated, but have a look at the pictures, and once you've watched someone doing it, it's quite obvious what to do.
Yeah, quite satisfying as well.
I always feel like a surgeon when I get that.
Yeah. Then with your apron, you unfasten or break the neckties and allow the top part of the apron to fall forward. Unfasten or break the waist ties and pull the apron away from the body, touching the inside only of the apron. Fold or roll into a bundle and discard.
If you're wearing a gown, you're going to unfasten the neck, then the waist ties, remove using a peeling motion, pull the gown from each shoulder towards the same hand and hold the removed gown away from the body, fold into a roll or bundle and discard.
And then your eye protection, so this is a goggles or face shield. Handle eye protection only by the headband or the sides. Face shields and glasses should be removed by grasping sides and pulling directly forward away from the face. I'm doing it as I'm telling you. To remove goggles with an elasticated headband, tilt the head forward and grasp the headband with index fingers and thumbs and lift the headband upwards while pushing frame away from the face. Lower goggles away from face and discard.
And then masks, finally, you're going to unfasten the ties, first the bottom one and then the top one, or if elasticated, pull the top and bottom elastic together and pull away from the face without touching the front of the mask or the respirator and discard.
Yeah. So all PPE should be removed before leaving the care area and immediately disposed of directly into the appropriate waste system, as we've said, or a designated receptacle for reusable PPE. And then we'll say it again, you need to perform hand hygiene immediately upon removal of your PPE.
And that's right up to your elbows if you're wearing an apron. Obviously, if you're in a gown, then your forearms won't have been exposed. Yeah. So let's think about what PPE is available to clinical staff, because we've named some things there, haven't we, Minnie? So let's just start with gloves. So we've got 4 different types of gloves. We've got examination gloves. These are the ones at the ends of beds. So latex, nitrile, neoprene. We have surgical gloves, and these are sterile and high precision. There are chemotherapy rated gloves for handling toxic substances, and then heavy duty utility gloves for cleaning and disinfection.
These must be worn when exposure to blood and or other body fluids, non-intact skin or mucous membranes is anticipated or likely. They must be changed immediately after each patient and or after completing a procedure or task on the same patient, and hand hygiene performed. Does that make sense? Every time you remove your gloves, you need to wash your hands.
Absolutely correct, yes.
They must be changed if a perforation or a puncture is suspected, and that's really important. An appropriate use, fit for purpose and well-fitting, which you've already said about gloves, haven't you? That they need to be the right size.
Absolutely. You never want to decontaminate them with alcohol-based hand rub or soap between use. So you shouldn't be washing your gloves. You should be removing them and putting on a new pair if you need a new pair of gloves. They need to have a low risk of causing sensitization to the wearer because, as we talked about this in the hand hygiene module, didn't we, Minnie, about not getting hand dermatitis
Yeah.
from all our hygiene precautions. And they need to be appropriate for the task being undertaken. So it needs to take into account the substances being handled, the type and duration of contact, the size and comfort of gloves, and the task and requirement for glove robustness and sensitivity.
So we've mentioned quite a few different types of gloves. So when do we need to be wearing sterile gloves? So this is important when sterility is required, for example, in an operating theatre, and it's also required for some aseptic techniques, for example, insertion of a central venous catheter, peripherally inserted central catheter, insertion of pulmonary artery catheters, and spinal epidural and caudal procedures.
So double gloving is not recommended for routine clinical care. However, it may be required for some exposure-prone procedures. So, for example, orthopedic or gynecological operations, or when attending major trauma incidents, or as part of additional precautions for high consequence infectious disease management. So Ebola would be an example of this.
Yeah. So gloves are not required to carry out near patient administrative tasks. So things like using the phone, a computer or a tablet, writing on a patient's charts, giving oral medications or distributing or collecting patient dietary trays. So you don't need to be wearing gloves to do those, generally speaking.
Brilliant. And then for those people who wear oversleeves, they need to be changed immediately after each patient and or after completing a procedure or task, even on the same patient. And hand hygiene, as always, performed. And they need to be removed and disposed of if visibly contaminated or soiled.
Fantastic. And now let's move on to aprons. These need to be worn to protect uniform or clothes when contamination is likely or anticipated. You need to change them between patients and or after completing the procedure or task at hand.
Full body gowns or fluid-resistant coveralls must be worn when there's a risk of extensive splashing of blood and or body fluids, for example, in an operating theatre or an intensive care unit. Worn when a disposable apron provides inadequate cover for the procedure or task being performed. Again, changed between patients and removed immediately after completing a procedure or task, and must be sterile when sterility is required, for example, in an operating theatre or for those aseptic techniques that you mentioned earlier, Minnie. So central venous catheters, PICC lines, spinal procedures.
Yeah. Eye and face protection, so this includes full face visors. They must be worn if blood and or body fluid contamination to the eyes or face is likely or anticipated. For example, by members of a surgical team, and always during aerosol generating procedures, which we'll go on to explain what those are shortly.
Fantastic.
And really importantly, regular corrective spectacles or glasses are not considered eye protection. So you need to be putting something over the top of your normal glasses if you wear them. Not be impeded by accessories such as piercing or false eyelashes, and not be touched when being worn, which is quite difficult, actually. I think people would be surprised how often they want to touch their eyes.
Yes, I think it's a real thing. And I think my experience is that in countries where there aren't very many infectious diseases, we touch our faces a lot more. So I touch my face quite a lot more. But when I have worked in other countries where they have more infectious diseases, touching your face is a really stupid thing to do. And I have learned that the hard way, having had many stomach bugs from doing so. Right, let's move on to masks, Minnie. Respirator masks, which means they are made of a fabric designed to filter the air or impurities, are based on a grading system. And this indicates how much protection they offer. So FFP1 is the least protective and FFP3 is the most. FFP stands for filtering facepiece.
Yeah, there's a lot of technology that goes into face masks and lots of different types of face masks, which can be
So much information and three-letter anagrams. Yeah. So FFP1 or fluid-resistant surgical face masks protect against materials in concentrations of up to 4 times OELs or occupational exposure limit, or 4 times APFs, which are assigned protection factor. So they are required as a means of source control. So to protect the patient from the wearer during sterile procedures such as surgery, to protect the wearer when there is a risk of splashing or spraying of blood, body fluids, secretions or excretions onto the respiratory mucosa, and as an element of PPE for droplet precautions.
Okay, so FRSM, these are fluid-resistant surgical masks, must be worn with eye protection if a full face visor is not available, and spraying or splashing of blood, body fluid secretions or excretions onto the respiratory mucosa, so that's the nose and mouth, is anticipated. They must be worn to protect patients from the operator as a source of infection. They must be well-fitting and fit for purpose, fully covering the mouth and nose. And so you need to always follow the manufacturer's instructions to ensure effective fit and protection. They must be removed or changed at the end of a procedure or task. Again, if the mask integrity is breached in the same way that you change your gloves, you change your mask, and particularly if there's moisture buildup after extended use or from gross contamination from blood or body fluids. And again, change them in accordance with manufacturer's specific instructions.
So within these fluid-resistant surgical masks, there are different types. So there's type 1, 2, and 2R. 2R surgical masks are superior to type 1 and 2 because they are fluid resistant and also have high bacterial filtration efficacy, so BFE of greater than or equal to 98%, protecting both the wearer and others. They are the standard for high-risk clinical settings, so hospitals and dentists, and they offer better protection than type 1 masks, which only have 90% BFE. Brilliant.
So FFP2 obviously offers more protection than an FFP1, as we said, and these offers protections at higher concentrations of the OEL and AFPs of 12 and 10 respectively. They are the European equivalent of the N95 respirator masks that are used in the US, and they meet the guidance from the WHO.
And then FFP3 provides the highest level of protection, protecting against materials in concentrations of up to 50 times OEL or 20 times APF. And that's obviously substantially higher than FFP1, and they can block both liquid and solid aerosols. So the current UK guidelines stipulate FFP3 face masks for virus and bacterial infection control when the contagion is spread through coughing and sneezing. So, for example, coronavirus. They're often used by healthcare professionals when they're handling hazardous pharmaceutical chemicals.
So, Fran, for Ebola, would FFP3 be what you'd wear?
Yes, so you'd have an FFP3 or a powdered hood respirator for Ebola, Minnie.
But we'll talk about those later, won't we? That's another level entirely.
Yes, absolutely. Footwear.
Footwear. So this must be visibly clean, non-slip and well maintained, and support and cover the entire foot to avoid contamination with blood or other body fluids or potential injury from sharps. You don't want something with your toes sticking out.
Absolutely. No sandals.
No. Footwear must be removed before leaving a care area where dedicated footwear is used. So that's places like in an operating theatre. And these areas must have a decontamination schedule with responsibility assigned.
Brilliant. And then finally, headwear. So headwear is not routinely required in clinical areas unless part of theatre attire or to prevent contamination of the environment, such as in clean rooms. So headwear must be worn in theatre settings and clean rooms, for example, a central decontamination unit, well-fitting and completely cover the hair, changed or disposed of between clinical procedures, lists or tasks, and if contaminated with bloods and or body fluids, removed before leaving the theatre or the clean room. And then individuals with facial hair, so for example, men with beards or moustaches, must cover this in areas where headwear is required for it. So for example, they should wear a snood.
And it's worth noting that headwear that's worn for religious reasons, such as turbans, kippot veils, headscarves, must not compromise patient care and safety. They must be washed and or changed daily or immediately if contaminated, and comply with additional attire requirements, for example, in theatres.
So in addition to using appropriate PPE, frequent hand hygiene and respiratory hygiene should always be performed. As you said, PPE should be discarded in an appropriate waste container after use, and hand hygiene should be performed before putting on and taking off PPE or changing it.
Yeah.
And as I mentioned, don't forget to wash your forearms because these will have been exposed unless you are wearing a fluid-resistant gown.
Absolutely. So we're going to move on now to thinking about what PPE is required in different circumstances. And we've got some examples that we're going to run through, but please use your local guidance as to what level of PPE and standards you need in your own setting.
Brilliant. Level 1 PPE, Minnie. So this is standard precaution. The PPE required is disposable gloves, disposable apron, possibly eye and face protection if splashing is likely. And so this is used for when there is no infectious agent known or routine care with possible exposure to blood or body fluids. So hepatitis B, for example, in a non-aerosol generating tasks, hepatitis C, HIV for routine care, gastroenteritis without confirmed infectious cause, or a non-infectious diarrhea.
Brilliant. So level 2, these are contact precautions. So the PPE you need for this are gloves, apron or gown if more coverage is needed, eye and face protection if splash risk, and you're using these for diseases spread by direct or indirect contact. So things like Clostridioides difficile, MRSA, norovirus or salmonella.
And then level 2 PPE with droplet precautions. We're going to be using gloves, an apron or gown, a fluid resistant surgical mask, that's a type 2R, and eye protection. And this is used for diseases that are spread by respiratory droplets.
So what do we mean by respiratory droplets?
I had to remind myself of this. So a quick reminder for everyone else as well. Droplets are larger respiratory particles, so they are greater than 5 to 10 micrometers that typically fall to the ground quickly, while aerosols are smaller particles, so less than 5 micrometers that can remain suspended in the air for longer periods.
Thank you.
Yeah. Examples of droplet precautions. So illnesses may include influenza pertussis, which is also called whooping cough, meningococcal disease for initial management, RSV, so that's respiratory syncytial virus, and mumps.
And then our final level 2 PPE is covering airborne precautions. For this PPE, you need, again, gloves and apron and gown, but an FFP3 respirator and eye protection. So these are used for diseases spread by airborne particles, such as measles, pulmonary TB, COVID-19 during aerosol generating procedures, and SARS and MERS.
And then finally, we've got level 3 PPE. So these are enhanced precautions. So you're going to be using a reinforced fluid resistant long sleeved gown, hood, if the gown lacks a hood, full length apron, an FFP3 or powered hood respirator, a full face visor, double gloves, Wellington boots, and boot covers. So these are used for high consequence infectious diseases and require total body coverage and respiratory protection. So examples of these diseases would be Ebola, Marburg virus, Lassa fever, Crimean Congo hemorrhagic fever, Nipah virus, severe cases of Mpox, and any suspected hazard group 4 viral hemorrhagic fever.
On the transcript, we put some infographics of PPE that should be worn during the COVID and also Ebola outbreaks.
What we thought we'd do, didn't we, Minnie, is just run through, because we've got donning and doffing for Ebola, and given the outbreak at the moment, we thought it would be a very good idea to talk through that as well.
And it's just a little bit more complicated, isn't it?
Yeah. So let me start. So this is for any high consequence infectious disease. This is how you are going to don and doff. And as you said earlier, Minnie, doffing is when the most transmission occurs. And so you need to be incredibly careful when you are doing that. So you are always going to put your PPE on under the supervision of a trained buddy, and you do not use tape to secure your PPE in place. So the first thing you go do is you're going to remove all personal items. You're going to put on scrubs and rubber boots or Wellington boots, and you're going to tie your hair back if you have long hair.
So it's really important that you have the correct size of PPE and that you do not use damaged or expired PPE. And finally, before you start putting anything else on, you're going to perform your hand hygiene with either an alcohol rub or soap and water.
Brilliant. Firstly, put on the inner pair of gloves, followed by the coverall. And if there is a finger or thumb loop, you're going to put your finger or thumb through it.
Then we're putting on a non-collapsible medical mask and use a seal-checked respirator if performing aerosol-generating procedures. So we've talked about those when we've talked about masks and how important it is that you do have one that's fitted correctly.
Yeah. Put on the face shield or goggles and then pull the hood of the coverall over the head. So your whole face should be covered.
Yeah. Then you're going to be putting on a disposable or reusable waterproof apron. For hygienists, cleaners, waste handlers, and safe and dignified burial teams, you need to be using a heavy-duty apron.
And then you're going to put on your second pair of gloves over the cuffs. Again, for hygienists, cleaners, waste handlers, and burial teams, you're going to use heavy-duty gloves.
And finally, ensure your buddy checks everything and name and time of entry are written on your PPE. So some of them come with a little label, but you might just need to write it with a pen on your PPE, the name and time that your PPE is being put on.
So let's go on to doffing.
So, sorry, Fran, just before we go on to that, there's just a little note about if boots are not available, use slip-on shoes, no laces, that cover the ankle and the top of the foot.
So you want no skin exposed whatsoever.
Exactly.
Steps to remove, so steps to doff for doffing your PPE. So you're always going to remove it under the supervision of your trained buddies so they can watch to make sure you're doing it correctly. This is a little bit contrary to what we were saying earlier on, Minnie. So the first thing you're going to do is perform glove disinfectant of the outer gloves with alcohol-based hand rub or soap and water.
Then you're going to untie or break the apron straps from the back or waist and remove the apron again by leaning forward and keeping it away from the body. If it's a disposable apron, place it in the waste bin. If it's a reusable or a heavy-duty apron, place it in the bucket for decontamination.
You're then again going to perform disinfection of the outer gloves with an alcohol-based hand rub or soap and water.
Move on to remove this outer pair of gloves and dispose of them safely in a waste bin. And if you've been wearing heavy-duty gloves, then again, these are probably reusable, so they'll be placed in the bucket for decontamination.
And then again, Minnie, you're going to perform glove disinfection, but this is of your inner gloves because you've just removed your outer gloves with alcohol-based hand rub or soap and water.
Okay, next we're removing our head and neck covering from back to front and disposing it safely in the waste bin.
And again, this is my role here, perform glove disinfection of your inner gloves with alcohol-based hand rub or soap and water.
Now we're moving on to removing the gown, and we're doing this by removing it from back to front, rolling it from inside to outside and disposing it safely in the waste bin.
And again, you're going to glove disinfect your inner gloves with alcohol-based hand rub or soap and water.
Removing our eye protection, you're doing this by lifting the straps from behind the head and dispose of it safely in the waste bin.
Once more, you're going to do your glove disinfectant with alcohol-based hand rub or soap and water.
Next comes the removal of the mask, and we do this by removing it from behind the head by first lifting the bottom straps above the head and leaving it hanging in front, and then lift the top strap from behind the head and dispose of it safely in the waste bin.
And again, glove disinfection of your inner glove, hand rub or soap and water.
And now we're going to remove the inner gloves and perform hand hygiene with the alcohol rub or soap and water. And we're removing it in the same way as we described before. And there's on the transcript, on the infographic, there's a really lovely diagram of each stage of removing the gloves.
That's
I'm
great.
sure it's something you're all pretty familiar with, though.
Yeah. Then you're going to step into a 0.5% chlorine foot bath and step out of the foot bath and remove the rubber boots without touching them.
And finally, it's my turn, Fran. You're going to be performing hand hygiene with an alcohol-based hand rub or soap and water.
And this is so important. Oh my gosh, it is so important.
It is so important. And it's really long, isn't it? I mean, you've got to be really careful and do each step properly.
Yeah.
With your buddy watching like a hawk.
You absolutely cannot rush this. Yeah. Really, really important. And I think the thing that's really awful at the moment on the news, Minnie, so there's this new outbreak that's just been declared in the DRC and Uganda, is that people from the DRC are saying we don't have any PPE.
Yes, I saw that, Fran.
And that's just awful. Yeah, awful. Minnie, you put up another infographic about Ebola and Marburg disease.
Yeah, so this is just showing the different types of PPE needed at different stages during an outbreak. So it's sort of infection prevention and control. It summarises some of the key points from the updated WHO guidance published in August of 2023. And it tracks the patient journey, giving suggestions of PPE for health and care workers as they interact with the patients. So all along the journey from the patient's home into healthcare, screening and then in and care in a designated facility. So it's just really for interest and to look through and see, whether this applies to you in your setting.
I think it's really useful. Yeah, absolutely. Yeah,
Yeah.
please
So
have a
we're
look.
not going to talk through that, but please do have a look at it.
Yeah. But what we are going to talk through is aerosol generating procedures, because we've mentioned those a couple of times. So what are they? They are medical and patient care procedures that result in the production of airborne particles or aerosols that create the potential transmission of infections that may otherwise only be transmissible by the droplet route. So let's just run through some examples. Intubation, extubation, and related procedures. So, for example, manual ventilation and open suctioning of the respiratory tract, including the upper respiratory tract.
So tracheotomy or tracheostomy procedures, insertion, open suctioning or removal.
Bronchoscopy and upper ENT airway procedures that involve suctioning.
Procedures like upper GI endoscopy, where there's an open suctioning of the upper respiratory tract.
Surgery and post-mortem procedures that involve high-speed devices.
Some dental procedures, for example, those that need high-speed drilling.
Non-invasive ventilation, for example, bi-level positive airway pressure ventilation, so BiPAP, or continuous positive airway pressure ventilation, such as CPAP.
And then other ventilation like high-frequency oscillatory ventilation, anything that induces sputum, and finally high-flow nasal oxygen.
Brilliant. So those are all procedures that you need to be incredibly careful with, and during an Ebola outbreak, I wouldn't be doing any of those.
No.
Maybe high flow oxygen, but that
I
would be it.
think, if you've got a very sick patient who needs multi-organ support, you are going to end up being in an environment where there are aerosols produced. So you're going to be in your high level PPE anyway. And so that's just really important. To the doffing there is just really, really important.
Yeah. I guess the thing with all of these things, isn't it, is unfortunately for lots of these patients with Ebola, there won't be these ITUs where they could be intubated and have high level care. I mean, there will be, I know that there are some people already being flown back to America, for example, who they're worried may have caught it. So, there are always individuals who come back to high income countries and will receive that care. But for the majority of people, unfortunately, who are catching Ebola and dying from it, they just won't be getting that level of care.
It is really shocking because there are amazing facilities for looking after patients with these very contagious diseases, but they're just not available everywhere.
They're in the wrong place, aren't they? Minnie and I thought we'd talk a little bit about cardiopulmonary resuscitation. So there aren't actually any guidelines on this specifically for Ebola or specifically for various infectious diseases, but we thought we would just talk about what's sensible. It first came about during COVID, didn't
Yeah,
it?
it did.
So people were like, well, what do we do during COVID if somebody collapses in front of us? The Resuscitation Council of the UK offered the following advice during the early COVID pandemic. So for adults, CPR, they said, recognize a cardiac arrest by looking for the absence of signs of life and the absence of normal breathing. Do not put your face near the patient. So normally you would listen or feel for breathing by putting your face down near the mouth and your cheek close to the patient's mouth. But if you're, don't be doing that. And if you're any doubt about confirming cardiac arrest, the default position is just to start chest compressions until help arrives.
And if someone is not in cardiac arrest and they're conscious, they'll pretty soon push you off.
They absolutely will. Yes, absolutely.
So if there is a perceived risk of infection, rescuers should place a cloth or a towel over the arrested victim's mouth and nose and attempt compression-only CPR and early defibrillation until the ambulance or advanced care team arrives. Just to remind ourselves, when you're doing chest compressions, you're putting your hands together in the middle of the chest, keeping your arms straight and pushing hard and fast.
So we know that early use of a defibrillator significantly increases the person's chances of survival and does not increase the risk of infection. Obviously, if the rescuer has access to personal protective equipment, for example, an FFP3 face mask, disposable gloves or eye protection, these should be worn. And I mean, it's going to vary very much, Minnie, isn't it, on whether this is someone who collapses in front of you on the street and you have no idea of their infection risk, or whether it's somebody in hospital and you do know, what potentially what their diagnosis is.
Exactly, yeah. And after you've performed compression-only CPR, All rescuers should wash their hands thoroughly with soap and water. Alcohol-based hand gel is a convenient alternative, as we discussed in it.
Thinking about children instead, so it's likely that a child or an infant that's having an out-of-hospital cardiac arrest will be known to you. So it's likely to be, you know, a neighbour or your own child, and that doing rescue breaths, which is what is needed for a child, will increase the risk of transmitting any infectious disease, either to you, the rescuer, or from you to the child or infant. However, this risk is small compared with the risk of taking no action at all, because that will result in certain cardiac arrest and the death of the child. So, yeah, please do go on ahead and do rescue breaths.
As they brought out these guidance during COVID, I tried to find to see if there was anything similar that the Resuscitation Council have put out in terms of, you know, really contagious infections like Ebola, but there really isn't anything. So if you're in an area where there are these infections around, there's no sort of specific bystander advice. But in a healthcare setting, you know, it does change what you might do.
Absolutely.
With someone that you know has Ebola. In known Ebola cases, Fran, we know, don't we, that there is an extreme exposure risk. In CPR procedures, so that these include things like chest compression, opening an airway, suctioning, intubation, and during these procedures, there's often uncontrolled release of body fluids, so saliva, vomit, blood. So these really pose a life-threatening risk to healthcare providers. If you're not already in your PPE, you know, having to put PPE on would compromises the time in starting CPR. So not that you should ever not do this in this circumstance. You know, donning the equipment is really important, but it requires...
And donning it correctly and slowly, yeah.
So the donning that's required and the high level of PPE is time consuming, and delaying it makes CPR largely ineffective anyway.
Yeah. And I think more importantly, Minnie, is that if this is a known Ebola case and they are going into cardiac arrest, their prognosis is so poor.
Yeah.
You know, so a cardiac arrest is going to be happening in late stage Ebola, and it's typically a result of multi-organ failure or septic shock. So survival rates are, you know, somewhere near the zeros, aren't they? Even if CPR is initiated. You know, really, if you're in a healthcare setting and you know this patient has Ebola, don't start doing it. And what you should be doing is talking with the family before you get to this point to explain that you wouldn't be doing it, because it wouldn't be in not only in the patient's best interest, because you wouldn't manage to resuscitate them, and it is incredibly traumatic, isn't it? Doing CPR, you break ribs, there's, like you said, there's blood, there's vomit everywhere, but also you're putting everyone at risk. So you're putting the healthcare worker at risk, but even if the family members are in the room as well, you're putting them at massive risk as well from transmission.
As you say, the discussion beforehand and having a realistic expectation of what an outcome would be is so helpful, and means people can accept things much better at the time. And
and I think it's such a shame when that doesn't happen. And I had a case recently, nothing to do with an infectious disease, of an elderly patient, and we talked about not resuscitating them, and I had done the form and I had told them to come and collect it, and they hadn't collected it, and she arrested, and of course she got resuscitated, and it was awful, you know, and she got taken to hospital. She was very elderly, very frail, and then, you know, inevitably sadly died. And the husband, when I saw him afterwards, was like, I'm so sorry that I didn't collect that form, because all of that just shouldn't have happened. And it's distressing for him to have witnessed, and for the patient to have that in her, you know, last hours and minutes of life.
Okay, so let's just quickly summarize PPE, Fran. PPE is not a one-size-fits-all solution. Healthcare workers need to assess the specific exposure risk, you know, to blood, body fluids, or aerosols before a procedure, and then to select the appropriate level of protection.
And to labour the point here, the process of donning, so putting on, and doffing, taking off, is just as important as the equipment itself. So most transmission risks occur during removal. So clinicians are urged to take their time, even in emergencies, and decontaminate or dispose of items immediately after patient contact.
PPE failure has devastating long-term consequences. You know, during the Ebola outbreak in 2014, as we said, over 800 healthcare workers died. And COVID-19 deaths among health and care workers were estimated between 80 and 180,000 deaths from January 2020 up until about May 2021.
It was huge, wasn't it?
Yeah, it is.
And just think
they're
about
avoidable. I mean, that's the thing, isn't it?
Yes, I mean it was absolutely tragic. Aerosol versus droplet precautions. So let's just remember that droplets require, so these are our larger droplets require fluid-resistant surgical masks, whereas aerosols, which are these smaller suspended particles, require high-level FFP3 respirators, especially during aerosol generating procedures, which we talked about. So examples again are intubation or high flow oxygen therapy.
And finally, just modified emergency protocols. During outbreaks or pandemics, standard emergency procedures change to protect the rescuer.
Yeah, and just again, Minnie, I think what you said at the start, which was so useful, which was our tip, wasn't it? Was about you are the most important person in this. And so, do not approach the patient, do not put yourself at risk. Your safety is paramount.
Thank you so much for listening. And remember, you can download the supporting notes, complete the CPD quiz, and receive your certificate at www.horizonmedicaleducation.com. If you found this episode useful, please share it with your colleagues and follow us for weekly episodes. Goodbye.